From the American Association of Nurse Practitioners, I'm your host, Dr. Sophia Thomas, and this is NP Pulse, the voice of the nurse practitioner. Welcome to NP Pulse, AANP's official podcast, bringing you unique nurse practitioner voices and expertise on issues that matter to NPs and to our patients. Nearly 20 people are physically abused by an intimate partner in the U.S. every minute. Yet domestic violence is underreported. Today on NP Pulse, we will speak to Dr. Doncy Eapen on the public health issue of domestic violence and its impact. Welcome to NP Pulse.
Thank you so much for having me.
Well, Doncy, I'm so glad to have you. I think this is a very important topic. We're going to discuss domestic violence and everything around that, but I want our viewers and our listeners to get to know you. So tell us, Doncy, your NP story.
Okay. So my name is Doncy Eapen. Actually, I work right now. Currently, I'm an assistant professor at the UT Health, the Physics School of Nursing in Houston, Texas. So regarding my NP story, I did my bachelor's as well as master's in nursing from Manipal College of Nursing in India. And then I came here to the United States in 2005. I actually decided to start my PhD program. So we actually came to Kansas City, Kansas.
That's a big change.
It is a big change. It's a beautiful place, Kansas City. So I actually joined University of Kansas, where I started doing my PhD program. At the same time, I was working as a RN in the hospital, and I saw the NP role. You know, NP role is something that was new for me, because in India, we didn't have nurse practitioners at that time. And I saw how NPs can do a lot of things, you know. It gives them autonomy, especially family nurse practitioners. They have a lot of things that they can do. So I got really interested. So even though I joined my PhD program, I thought I want to do NP. So I actually took a break from my PhD program and did my NP for 2 years before I resumed all the classes back in the PhD program.
Wow.
So it was a longer route that I took, that not many people would do that. Mm-hmm. But, you know, I'm glad I did that. So it gave me the opportunity to practice as an NP after that.
That's great. And where are you located now?
Now we are in Houston, Texas, actually suburb of Houston, which is Richmond, Texas.
Okay. And where do you work?
University of Texas Health Science Center in Houston, Texas.
Right. And what is your role there?
I am in the undergraduate department, but I teach both in the undergraduate department and the graduate department, and I actually do research among women and families and youth who experience domestic violence as well as homelessness.
Wow, that's a lot to unpack there. And I know the statistics are amazing for the number of people who experience domestic violence every minute. And I know there's a difference between, we use domestic violence and domestic abuse, I think, interchangeably, but there are lots of forms of domestic violence, right?
Right. So we talk about whenever domestic violence is, sometimes people use intimate partner violence and domestic violence interchangeably, but domestic violence include also not the partner violence, it also include non-partner violence. For example, you live in a household, a person can get abused by their parents or siblings or cousins or uncles or aunts. That is also domestic violence. But a lot of domestic violence is partner violence. So intimate partner violence, I would say, is a part of domestic violence, even though these terms are used interchangeably.
Wow. And then there are lots of forms of abuse. There's physical abuse, but then there's emotional abuse?
Oh, yeah. Physical violence is one form of domestic violence, and there is psychological abuse. There is financial abuse. Then what we call is sexual violence, as well as stalking is a form of domestic violence.
Stalking?
Stalking is a form of domestic violence, which, before I got into the field, I didn't know they would consider that as domestic violence.
And can the emotional abuse progress to become physical abuse?
Yes. Usually in a partner in a relationship, initially the red flags that we talk about is, before it progresses to physical violence, it's mostly the emotional abuse that starts, and then it progresses to physical abuse, physical violence.
And so what kind of research are you doing with the domestic abuse and
We have actually a lot of research projects going on at this time. We have some qualitative project where we actually explore the experiences of women, especially pregnancy-related intimate partner violence. Means those who are pregnant. We're trying to find what are their experiences. How are their experiences different from somebody who is not pregnant. Whether pregnancy is a protective factor, or is pregnancy will it make the abuse worse? And then we are also doing an intervention study among women who have a history of domestic violence, but they are now homeless. So they are in homeless shelters or domestic violence shelters. So we are giving them, and actually our study is in the pilot study project, which actually we are looking at the feasibility of some evidence-based intervention. So we give 2 interventions for them. One is a counseling intervention. So think about domestic violence when they are actually experiencing domestic violence. Domestic violence is a disempowering experience. A lot of the participants or women who experience domestic violence, they have this low self-esteem. They feel, guilty. They feel like it is their fault. That is how the abuser, gives that kind of feeling, or, that's what the abuser tells them, that, okay, this is your fault, right? So they are in that feeling of guilt, shame. And we also found that they never had this good parenting role model. So these are from some of the studies that we actually did. So what we are trying to do is teach them positive parenting skills. So the parenting intervention that we use for that is called PALS, which is play and learning strategies. So what we do is we are actually using that intervention, and we want to teach these women these parenting strategies. So in order for them to learn that parenting strategies, we have to first empower them or help them, support them with the counseling intervention. So the counseling intervention that we use is called RISE. RISE stands for Recovering from Intimate Partner Violence to Strength and Empowerment. And this is an intervention developed by Veterans Health Administration, VHA. Dr. Iverson is the founder of that. Mm-hmm. So we have a great team who are working together. So we first provide them with counseling session, and then we provide them with parenting session. And we are actually checking the feasibility of that intervention now. And this is the second pilot we are running. And the results from the first pilot were amazing, like how women were so thankful about this opportunity, because otherwise they won't get this intervention. Mm-hmm. So it was such a nice experience.
That's amazing. And I know domestic violence can occur whether you are male or female. Anybody can be a victim of domestic violence. And when when an individual is the victim of domestic violence, you mentioned a couple of feelings that they feel they're not empowered, they're not strong. Oftentimes they are stuck there, right?
Right. So domestic violence can happen among men too. Unfortunately, men don't have all the resources that women have. A lot of the times men do experience psychological abuse from women. So men also need support when they experience domestic violence.
And when they're experiencing domestic violence, you mentioned financial abuse. What is that?
Well, the financial abuse is like if a partner has to financially dependent on the other partner. Say, for example, a woman who does not, who do not have a job, and they are financially dependent on their partner, then it is like, and most of the time the partner would have this controlling behaviors. So they would control them financially. And that's one form. And the other form is that even though women are working, if your abuser is controlling, then they control the finances, even the income that women bring. So there are different forms of financial abuse. And one of the reasons why women tend to stay in an abusive relationship is because they are not financially independent. I mean, what is your option, whether to actually, meet your basic needs or to flee violent situation and go to a shelter? Those are the choices, hard choices. And even, it's not easy to get into a shelter. Mm-hmm. There are lots of barriers that prevent them getting the appropriate support that they need.
Mm-hmm. And domestic abuse can occur in every socioeconomic level,
Definitely. It is something that happens not just in, there are certain risk groups, like risk factors, but it happens everywhere. Regardless of what race you are, what gender you are, what nationality, what economic status you have, what social status, it can happen to anyone.
Mm-hmm. So as a nurse practitioner, what are the things that I should be aware of in my patients, my patient population, that may key into considerations for possible domestic abuse? What are some red flags?
Well, one of the things that we can do is screening, right, as nurse practitioners. Unfortunately, some of the participants that we talked to during our study, they talk about how they have not been asked that question. So something that we can easily miss, because that's not something that it get prioritized all the time, because we are in a busy clinic, as practitioners are busy clinic. Your priority is to actually see the patient for a wellness physical or for their physical problems or whatever they're coming with, chief complaint. They don't come with domestic abuse as a chief complaint. How many would come? I don't think anybody would come there as a domestic abuse as a chief complaint. So what happens is that the screening don't happen all the time, So something nurse practitioners can do is screen your patients and to look for red flags. What are some of the red flags? What are some of the nonverbal signs? During your physical examination, are you seeing any signs of abuse? Or is the partner present? And if the partner is present and not leaving your patient, is it something that the patient is, you may have to take your patient to a room and talk to them in private. Are they, in terms of hygiene and things like that, are they, well kept, So there are nonverbal things that you can look for. Are they afraid to speak in front of the partner? There are nonverbal cues that you can look for. I think screening is not, I don't know how many practices do it, but that is something that they can easily miss. I think people are getting more and more aware about that we have to screen patients for domestic abuse.
Mm-hmm. And what screening tools, are there screening tools out there, or is it just asking questions? How is the screen done?
There are lots of screening tools out there. HITS is one of them, which is for, hurt, insult, threat, scream. Has anyone or your partner has, hit you, threatened you, insult you, so those kinds of questions. There are small questions that can be, actually you don't have to spend a lot of time asking those questions. They are very simple tools. You don't have to bring the word domestic abuse and perpetrator and victim immediately. You can say that something that normalizes the tone that you're asking. Like, say, for example, you can say okay, sometimes I see a lot of patients, there is a lot of trauma going on, so I want to make sure that you're okay. So, is everything okay at home? Do you have any concerns for safety? Those are simple questions that you can ask. It doesn't necessarily mean they will reveal it, because, as you know, domestic violence is underreported due to a lot of reasons, because of fear of, what they will do, because they stay in a committed relationship and they don't know what would be the next step. They fear retaliation, like what if they tell about their abuser and their abuser come to know. So there is a lot of barriers. So, you cannot pressurize a person to reveal a domestic abuse, but if they do disclose, just, support them, validate that experience, thank them for trusting you with that important piece of information.
And then what? So if my patient says, if I say to my patient, do you feel safe at home? Are there any concerns? Is there anything going on at home? And my patient says yes, and he or she says, my partner hits me or takes all my money and doesn't let me go anywhere. What do I do at that point?
You can't do it all alone. Nurse practitioners needs the support of the multidisciplinary, you need support of social worker, you need to have the information, community resources available there about the shelters that are available out there, case manager, social worker. Those are important people that would be helpful for you at that time. So something that we would tell our patients is talk about, what are the safety precautions that you can take, if you have to flee the situation, if you ever decide to leave the situation or the house because leave your partner, then what are the safety precautions that you need to take? You talk about an emergency kit. You talk about having a friend available or somebody who you can trust. If you feel like you need to call 911, maybe you can, inform someone to call, your trusted person. Maybe it may be a family member, maybe a friend. You can use probably a code word to ask them. If I say this code word, that means it is call 911. And sometimes it could be your children. If you have an adult children at home, it could be somebody who can call 911 if they're able to do that. And, you can tell them to do that. So those are the things. Safety planning it's applicable for everybody. Doesn't matter whether they are in that relationship or whether they're, planning to leave the relationship.
Yeah, so it sounds like if I'm a nurse practitioner at a practice, I need to consider if at any time a patient of mine admits that they're undergoing some sort of domestic abuse, intimate partner violence, I need to have a plan in place at my practice for these are who my community resources are and have them already prepared rather than leaving that exam room and having to go run and start Googling, what do I do at this point? Who are my people? So it sounds like it would be a good plan for everybody to have an office plan for if a patient admits this.
Yes.
And so why do you think domestic violence is so underreported?
Well, it's a lot of things. I mean, first of all, in some cultures, the domestic violence is something that is being, tolerated for such a long time. It's okay for a man to hit a woman, not the other way. Some cultures do not accept that. And that is something that they have been growing up with, that they have been brought up. Like, I would tell you this. In India, a lot of women, get killed by their partner. The women actually, when they talk about something like that, what is advice they get? Their parents would tell you, okay, well, you have to adjust. This is going to be how married life is going to be.
Mm-hmm. Accept it.
It is accepted.
Yeah.
It is accepted. So they don't take it seriously, or they think, well, once you're married for the life. So no matter however your partner is going to be, you have to grow. You have to adjust to that. For your family, you have to make some sacrifices, and that is maybe hitting and pushing and pulling and all these things that they're doing. You have to accept it.
And what about the intergenerational cycle of violence? Is that something that
Yes,
is a real thing?
It is a very real thing. So when we see women who actually, are in situations like this, they did not have good parenting role model, first of all. Their parents were abused by their parents. So what they see is, they get abused by their parents. So when you are exposed to, and it's a child, either you are getting abused from your parent or you're exposed to violence, right? When you're exposed to violence, the violence is a learned and taught behavior. No child is born into this world thinking that they want to do this, right?
Yeah.
They learn it. So when parents actually have this relationship that is abusive relationship, that is what the child sees.
Children live what they learn and learn what they live.
Correct, exactly. So they think, okay, an aggressive form of behavior, that is how they solve problems. That's what they learn. So when they go into such an aggressive a relationship which is similar, they think that is okay. It's either you're tolerating such behavior, that means you're a victim or a survivor, or you become the perpetrator. So that's what they have learned. So this cycle continues, right? So in school, when they go, we all know that children get bullied in school, right? And then once they, from out of that school, they go to teenagers and they get into a dating relationship or dating violence, where in that relationship also they get, either they become the perpetrator or they become the survivor. And then after that, the cycle continues. Yeah. See, that is how our parenting intervention is very significant, because we are trying to break that cycle. Because somewhere you have to break that cycle and say that this is not acceptable, right? Yeah. This is not normal. And they need parents need, so it has to start at home. So parents need all these tools and additional resources. Say that, no, you can actually parent a child without having to see the abusive relationship or without causing any psychological or physical trauma for them. That's what we are trying to do.
It's amazing the work that you're doing, and it sounds like it's something that we should be doing all over the country. Now, what are some things, as we sit here today, what are 3 things that you could say that nurse practitioners can do to help with awareness of domestic violence, or help with the recognition of domestic violence or intimate partner violence?
Well, one thing the nurse practitioners could do is, one thing is that we need to educate our nurse practitioners more, and it has to start with our schools, nursing schools. Unfortunately, there is not a lot of teaching about intimate partner violence or domestic violence. We don't place a lot of importance on it, but that's something that we could integrate more in our nursing schools. And especially, if you could actually put that in simulation, like a role play where, you do all the standardized patient, where how would you actually manage a patient with domestic violence if they report? Which is one thing we can do. Another thing is screening is extremely important as primary care nurse practitioners. We could integrate trauma-informed care in our practice, which is focused on empowering the survivor, focused on multidisciplinary collaboration, focused on safety of the survivor, giving them a voice, giving them autonomy, respecting their confidentiality. All those things can be integrated. So in our practice, wherever we practice, if we integrate trauma-informed care, and that has to start just not with the nurse practitioners. Whoever is working with you, you may have to train your staff about recognizing abuse. You may have to train, you may have to have a system where that is routinely asked, and that is given a priority.
Yeah, in my practice, we routinely do the PHQ-2s, and we're doing those depression screens, and we're making sure that our asthma screening forms and our diabetes screening forms, all these other screening forms are done. But I think probably the most critical, you could argue, would be for screening for domestic abuse, because people's lives are at stake.
Yes, exactly.
And so I appreciate the work that you do.
Thank you.
This has been a very educational conversation, and we do need to improve the screening. And I think with the screening tools you've recommended, and the education that you provide and the research that you're doing, you are definitely helping improve the statistics. So thank you so much for everything you do.
Yeah, thank you. Thank you for this opportunity, and really enjoyed talking with you.
You as well.
Thank you.
Thank you, Doncy, for joining us on NP Pulse. And thank you all for listening. Please subscribe to this podcast, share it with your friends and colleagues, and check back regularly for new episodes. And as always, be kind, be safe, be effective, and be the voice of the nurse practitioner.